Neurodegenerative disorders, complete overview. What are neurodegenerative disorders? Neurodegenerative disorders are a group of diseases that involve the progressive degeneration or breakdown of the structure and function of the nervous system, especially the brain and spinal cord. These conditions worsen over time and often lead to permanent disability or death. They primarily affect neurons, the basic building blocks of the nervous system, which cannot regenerate once they are damaged or die. Types of neurodegenerative disorders and how they affect health. 1. Alzheimer's disease. The most common form of dementia, causing memory loss, confusion, personality changes, and difficulty with language and reasoning. It results from abnormal protein buildup in the brain, especially amyloid plaques and tau tangles. It gradually affects thinking, behavior, and eventually the ability to perform basic tasks. 2. Parkinson's disease. Affects movement control due to the loss of dopamine-producing neurons in a part of the brain called the substantia nigra. Symptoms include tremors, stiffness, slow movement, balance issues, and in later stages, cognitive decline. Can also affect mood and cause depression, sleep problems, and swallowing difficulties. 3. Amyotrophic lateral sclerosis, ALS, motor neuron disease. Affects the motor neurons that control muscle movement. Causes progressive weakness, muscle wasting, difficulty speaking, swallowing, and eventually breathing. The mind is usually unaffected in early stages, making it particularly distressing. 4. Huntington's disease. A genetic disorder caused by a faulty gene that leads to brain cell death. Symptoms include uncontrolled movements, chorea, emotional disturbances, and severe cognitive decline. It typically begins in mid-adulthood and worsens progressively. 5. Multiple sclerosis, MS. Although not traditionally classified as purely neurodegenerative, MS involves immune-mediated damage to the protective sheath, myelin, of nerve fibers in the brain and spinal cord. Leads to a wide range of symptoms: numbness, fatigue, vision problems, coordination issues, and sometimes paralysis. 6. Frontotemporal dementia, FTD. Affects the front and sides of the brain, impacting personality, behavior, and language before memory is affected. Often misdiagnosed as psychiatric illness or Alzheimer's in younger patients. 7. Spinocerebellar ataxia. A group of genetic disorders that cause loss of coordination and balance due to damage to the cerebellum. Over time, walking, speaking, and fine motor skills deteriorate. How these disorders affect human health. Neurodegenerative diseases have a devastating impact on health and quality of life. They can cause progressive loss of memory, reasoning, and decision-making, muscle weakness, tremors, stiffness, and coordination problems, speech and communication difficulties, emotional instability, depression, and anxiety, loss of independence and need for full-time care, increased risk of falls, aspiration, and infections, shortened life expectancy in advanced stages. They also affect caregivers emotionally and financially due to long-term dependence and complex care needs. Risk factors. Several risk factors increase the likelihood of developing neurodegenerative diseases, including age. Risk increases with aging, especially after 60. Genetics. Family history can play a role, e.g. Huntington's, early onset Alzheimer's. Gender. Some diseases affect one gender more, e.g. Parkinson's in men, MS in women. Lifestyle. Smoking, poor diet, physical inactivity, and chronic stress may contribute. Environmental exposures, pesticides, heavy metals, and air pollution may raise risk. Head trauma, repeated brain injuries increase the chance of developing conditions like Alzheimer's or Parkinson's. Chronic conditions, diabetes, high blood pressure, and obesity may increase risk by damaging brain blood vessels. Prevention and risk reduction. There's no guaranteed way to prevent neurodegenerative diseases, but adopting brain-healthy habits can help reduce risk. Stay physically active. Exercise improves blood flow to the brain and stimulates neuron growth. Eat a brain-friendly diet, Mediterranean or DASH diets rich in fruits, vegetables, fish, whole grains, and healthy fats. Mental stimulation, lifelong learning, reading, puzzles, and hobbies help maintain cognitive reserves. Quality sleep, 7 to 9 hours of restful sleep helps flush harmful proteins from the brain. Social connection, staying engaged with others reduces stress and helps preserve cognitive health. Avoid toxins, limit exposure to air pollution, pesticides, and harmful chemicals. Protect your head, use helmets and prevent falls to avoid brain injuries. Manage chronic illnesses, control diabetes, hypertension, and cholesterol to support brain health. Control and management. Though these conditions have no cure, their symptoms can be managed to improve quality of life. Medical management. Medications used to slow progression or ease symptoms, e.g. levodopa for Parkinson's, cholinesterase inhibitors for Alzheimer's. Speech and physical therapy helps maintain function and communication. Psychiatric care, antidepressants, counseling, and support for mood changes or behavioral problems. Nutrition and hydration support to prevent weight loss, swallowing issues, or dehydration. Supportive and long-term care. Home modifications for safety, mobility, and independence. Assistive devices, walkers, wheelchairs, communication aids. Family and caregiver education reduces burnout and improves care quality. Palliative and end-of-life care for symptom relief. Dignity and emotional support. Summary and conclusion. Neurodegenerative diseases are serious, progressive brain and nerve conditions that lead to gradual loss of physical and mental function. They impact millions of people worldwide and create immense emotional, physical, and economic burdens. While most cannot be cured, their impact can be delayed or reduced with early diagnosis, healthy lifestyle changes, medical care, and strong support systems. Investing in brain health early in life through diet, exercise, social connection, and learning remains one of the most effective ways to protect yourself from these debilitating disorders. Take care of your brain, it's the only one you've got for life.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.